Good morning. My name is Manny Sarmiento. I'm the president of the Doral Chamber of Commerce. I am glad to be here with you. Let's say hello, first of all, to our producer, Tommy, in the back. And Carmen didn't want me to say that she was here, but Carmen, we always have to announce Carmen, our VP, our lovely VP. Got to bring her on camera one day. And with us, we have a VIP, very special guest, a VPP, very special VSP, very special person. I was so ecstatic. It took me 2 months to get you here, but we got you here. I had to bring you down from the country above Dade County. You know, you have to have a passport to come down here, a passport to go up there. So from Memorial Hospital Miramar, the CEO, Vedner Guerrier. I was so excited finally that this day was coming. As I said, it took 2 months to get you here, but we got you here, right? So welcome.
Well, thank you for having me, Manny, and better late than never.
Better late than never. Yeah, hopefully we can do this maybe 2-3 times a year or something. I really want some updates on Memorial Hospital. You guys have been members with us for a long time. We appreciate that very much. It's a chamber is a membership organization. That's how we survive, and some events, but membership is tops. And it's really great to have you guys on board as members of the Doral Chamber of Commerce. Really appreciate you. So let's start with I read everything that Ms. Nava sent me. You are a success story, and I love this. I love this because with this South Florida is an important cultural melting pot. I'm Cuban. You're going to tell me about you in a second and your history. This is so great to see, to hear these success stories. But I'll let you tell me the story now.
Well, South Florida is a special place for me. I'm very fortunate. I was born and raised in the Bahamas, but I am of Haitian heritage. So I grew up with both that mixture while growing up in the Bahamas of the Bahamian influence and obviously the Haitian influence of my dad while growing up. So that became very important. Fortunately enough, we were able to move from the Bahamas and come to Miami. And I was fit for Miami. One, we have a large Haitian community here in Miami, so that fit in. And I was fortunate as well. My father is a Spanish speaker who had spent some time actually working in Cuba through a shipping company while he lived in the Bahamas. So I had the basic fundamentals of Spanish enough growing up and being introduced to it. So when I came to South Florida, I was ready-made. I can make friends from the Cuban community and Hispanic community here, and I can make friends in the Haitian community. And obviously, growing up in the Bahamas, English was my first language. So
you have 3 languages.
3 languages. That is correct.
Wow, that's fantastic. I want to get off topic for a second because I've lived in South Florida since 1972, and what I have found that some of the most amazing people are Haitians. It is what makes the Haitian community so lovely. Because I haven't, as the saying says, I've never met a person that I didn't like. So what makes you guys so Haitians, I should say?
I think it comes down to, if you think about the experience, Haiti, unfortunately, has been a difficult place. So Haitians embrace education. Haitians embrace community. I think
family.
I
see that. Yeah.
So that's no different than, I would say, life in Cuba. People have survived because of family. You've been able to bond through whatever obstacles might come your way.
That's still our culture here. I remember we had to go to the dances when I was 15. It was a chaperón. Trae el chaperón contigo, niño, okay? Pórtate bien, okay?
Eso sí. So because of that, that's translated into that. And that commitment to hard work. I will tell you, in my household growing up, education was a big thing. It was supposed to be that gateway, and America facilitated that for us. So although I'll tell you a quick story. So my grandmother, my dad's mom, is unable to read and write, but she tells me the story that even though she was unable to read and write, she knew growing up that education was an important thing. She saw that. So all 12 of her kids in Haiti all have a high school or college level of education. Wow. So she made the effort, even though she was not able to benefit from it, but she made sure that her children were. So thinking myself as a grandchild, there was no other option. Education was the way. And the beauty is, we're talking about Miami and what Miami facilitates. I consider myself that success story because of Miami. I grew up here in terms of, I came here in middle school. I went to Thomas Jefferson Middle School in the North Miami area. High school, I went to Mass Academy, Maritime Academy of Science and
Wow.
Technology,
Wow.
first graduating class.
Wow. My niece was spent, I think, a year at Mass.
So
That's the one on Key Biscayne, right?
that is correct.
Fantastic.
So 4 special years at Mass Academy. I had an opportunity to go away, but actually I ended up coming back home, being homesick. And fortunately for me, I had a good friend who was working at Mount Sinai at the time. So while I was waiting to start my new semester, I started working at Mount Sinai as kind of like an orderly, helping patients. And I was taking patients to oncology to receive their cancer treatment. I befriended a radiation therapist and an engineer at Mount Sinai, encouraged me to go to school. I joined, Jackson at the time had a radiology program with Miami-Dade College. So I joined Miami-Dade College radiation program. I completed that, started working at Baptist, worked at Baptist for a couple of years, went to Mercy Hospital. And from Mercy Hospital, I made it to Memorial. And I've been at Memorial for 20 years.
So let's reiterate this. You went from orderly to CEO. Okay. So if someone wants to tell us there's no opportunities in this country, they're dead wrong, because you are living proof of that.
I agree. You have to work for it. I will tell you, when I went to school, I completed my radiation studies. I started working as a staff radiation therapist. Again, I joined Memorial in 2001. So in 2001, I joined Memorial. I'm a staff therapist. They afford the opportunity for those who want to advance. So what did I do? As I saw that my desire to go into leadership happened, I went back to school. So I went to Broward College and completed my bachelor's in supervision and management. After that, I still wanted more. I went to FIU and completed my MBA in healthcare through FIU.
I got goosebumps.
And so I am as homegrown as you can be without having been born here.
That's impressive. One thing you mentioned is that Memorial Hospital helped you through the education. They encouraged you to continue your studies?
Not only did they encourage me, they also helped because they provide reimbursement for people who are employed with Memorial who are seeking that further education. So that was the commitment of the organization. In addition to that, Memorial has a very robust mentorship program in which up and coming leaders, people who want it, are afforded and exposed to leadership and different opportunities to grow as an individual. That's
impressive. Impressive as personally what you did, because it took your effort. Okay, you had assistance from an amazing organization. I really, deep down, I know that education is the key. But when I find and I see companies like Memorial that gives you that support, that helps you, that's there for you, that pushes you, and is there for their people, for their employees, it's just impressive. So right here, I want to say Memorial Healthcare, I should say, right?
Correct.
Memorial Hospital, to the whole system. Great job. Keep that up, because that's the culture that really helps this country thrive, is that type of culture.
Absolutely.
And what they did with you and what I'm assuming they've done with many other people. But yours is really, I got goosebumps seriously talking about you, because when I was reading, I go, wow. But this was all you. It really is. Congratulations.
It's a blessing. It's a blessing.
Good. So where do you go from here? You're CEO, now what?
So right now, being a CEO, I'm exposed to different level of responsibilities now in my role as CEO at Memorial. And my focus is really, when we're talking about that engagement, when we talk about, I am located at Miramar. So I'm located on 172nd Avenue and Pembroke Road, or Miramar Parkway. So why is our engagement with Miami-Dade? What we have seen is that Miramar, to give you a little bit of history, Miramar opened back in 2005. And the way Miramar is situated, when you think about geographically, if you live on 138 and Grams Dairy Road up, Miramar is actually just 10 minutes away.
It's easy. Hop on 75.
Hop on 75 or the Turnpike, and you're there within 10 minutes. So we've seen that 50% of our patients have come from Miami-Dade County because they learned about Memorial and they trusted. Miramar is what I call it a baby hospital. We specialize in obstetrics. On average, we deliver about 300 babies a month.
But you have the Children's Hospital, right?
So we work with the Children's Hospital. We have Joe DiMaggio Children's Hospital, which is situated in Hollywood. but we have a lot of those practices there. And part of the reason why I'm excited to have the opportunity to talk to you is about the brand new medical office building that we're opening that we're calling the Women and Children's Pavilion. We're really going to be targeting on pediatric care. So we know that people that live in, say, Miami-Dade, Northwest Miami-Dade County, West Broward, want to be able to have their children receive that level of care that Joe DiMaggio provides locally. And Memorial Miramar is going to be able to facilitate that. So we're really excited about that.
That's exciting. So that's going to be on the west side at Memorial.
That's going to be at Memorial Miramar at the campus. We have a beautiful 4-story medical office building that's almost near completion.
When did Memorial Hospital get started with the Memorial Healthcare, the whole system? How many hospitals are there?
So the Memorial Healthcare system is made up of 6 hospitals. We have Memorial Hospital Regional, which also has Memorial Hospital, Joe DiMaggio's Children's Hospital, and Memorial Hospital South. That's on the east side of town.
Where? That's Hollywood, right?
That's Hollywood.
Off Hollywood Boulevard?
Off Hollywood Boulevard and 35th.
I know my brother lived in that area too before he moved to Cooper City.
Okay.
Right next to it. I think both of my niece and my nephew were born at Memorial, if I'm not mistaken. That's the hospital's right off Hollywood?
Right off of Hollywood, Johnson and 35th Avenue.
I think is there you have pediatrics there you have?
Correct. That's the Joe DiMaggio Children's Hospital,
Okay,
which we're now expanding and adding 4 additional floors onto.
Wow.
The Memorial Healthcare System started in the late, I believe in the mid 50s is when the hospital was established. And it was established to support the people of the South Broward district. So the South Broward community. If you think at that time, South Broward was really just Hollywood.
You couldn't go past it. You couldn't go past the turnpike. There was a Miramar Park, but there's nothing on the west side.
University was,
yes.
441 was it. Yeah. There was nothing west of that, really. So the hospitals expanded as the community is expanded. So we have a Memorial Hospital Pembroke, which is on Sheridan and University Boulevard. Then we have Memorial Hospital West, which opened around 1990. Memorial Hospital West opened, and that's on Flamingo and Pines Boulevard. And then as the community has expanded, because now we've gone all the way, we're all the way in West Broward now. We're about to hit Naples. Okay, so in that western area in West Miramar, so Memorial Hospital Miramar. So, and we also have and each of the memorials kind of really focus on, for example, we are a community hospital. We are providing many of the care that people in the community, if you're having an incident, you can have. But we also have our major quaternary care delivery. This is where we have the heart transplants and kidney transplants. And we have that at Memorial Hospital Regional, but at Memorial Hospital West, we have the oncology program, which is where we do the bone marrow transplants, radiation oncology, and those levels of care as well. So the Memorial Healthcare System, these conglomerate of these 6 hospitals working in tandem, we call it systemness because we work together. For example, if you show up to Memorial Miramar and there's a level of service that you need that I cannot provide at Miramar, we'll definitely get you to the other memorials so you can receive those services.
So that's amazing. Now, one thing I want to know is, because I'm always about customer service, what do you do? What makes a difference at Memorial Hospital Miramar and the rest of the Memorial Healthcare System that gives you guys such an amazing reputation? Because everybody talks about Memorial, about the Children's Hospital, always glowing about all the hospitals I've seen. Because like I said, I think my niece and nephew were born in the one in Hollywood. So what do you do? What's the culture that a company needs to have, like to be like Memorial Healthcare?
All right, Manny, I'm going to give you an orientation onto joining the Memorial Healthcare System. So when I do orientations with new employees, in particular, if you have an opportunity to visit Memorial Hospital Miramar, many a times people come to meet me at Memorial Miramar and they'll call like, "Where's the hospital?" And I said, "You're at the hospital." They're like, "Well, this looks like a hotel," because it really looks like a Renaissance, like an Italian villa or a Spanish villa when you walk onto the campus. And so during orientation, I tell the people, look around. We call this a Ritz. And what do you expect at the Ritz? You expect outstanding customer service. So we don't even talk about the customer service first. We talk about what we're most proudest of at the Memorial Healthcare System. That's safety and quality. So we are a Memorial Hospital Miramar in particular, we are an A-rated Leapfrog. So Leapfrog rates the delivery of quality care that's being delivered and how safely is it being done. Memorial Miramar, since its inception of the leapfrog process, has been an A-rated hospital. We're one of 26 in the nation rated A for our safety and quality. So when I have new orientees, that's what we talk about. The customer experience is expected. When it comes to press gaining for patient satisfaction, we see that. And Miramar has this very Latin community, family, as you mentioned, feel to it. And that permeates through every experience when a patient comes in, because they feel that sense of community. The important thing is that we truly want the patients to know we care about them.
And it shows. I mean, like I said, I've been in South Florida since '72. I've experienced it all. My brother lives in Broward. Has lived in Broward for a long time. My niece and nephew were born there. Anything and every time you hear about Memorial Hospital, it's like, wow, this is a quality place. Well, congratulations on that.
Thank you.
And before we forget, let's say congratulations to all the healthcare workers and everyone been through these 2 very challenging years. So congratulations and thank you. The work you do is just amazing. And I don't know if you're getting enough thanks, but thank you to all the healthcare workers. My niece is one of those. She works at Mercy.
Excellent.
And she loves her job. So maybe she should switch to you guys.
Always welcome.
Oh, I didn't say that.
Not that I'm recruiting, but always welcome.
Mercy's not a chamber member. You guys are. You're always. Oh, I'll tell her that. I'll tell her you said that. Yeah.
Absolutely, always welcome. Always welcome.
So, okay, let's talk about any plans for expansion into Dade County.
So, not expansion into Dade County. The services that we're providing and the experiences that we're affording people of the Miami-Dade community when they come to Memorial for their care, I think speaks for itself. As Miami-Dade expands, we're seeing this massive growth, so to speak, on that Broward-Dade border of Northwest Miami-Dade. We're open to be able to facilitate services that people will need. Again, as I said, this Women and Children's Initiative is really focusing 58% of all babies born in Broward County are born at a Memorial Hospital. Wow. But Memorial Miramar, what we see is there's this huge conglomerate of Miami-Dade residents, again, who've entrusted their care with us. So the word gets around, you have a good experience, you tell a friend, they tell a friend. And so that's what we've been seeing. In particular with COVID, we had patients coming all the way from Homestead, and my conversation would be like, why'd you come all the way here? Yeah. You've passed 7 or 8 different hospitals not feeling well, because they've entrusted their care with Memorial because of reputation and experience that others have had. So the services that we're providing, that expansion of children and pediatric care, is so that we can engage and assist the Miami-Dade County. For example, we had the fire departments from Hialeah and Fire Rescue come to us and say, listen, with Palmetto Hospital shutting down their pediatric ED.
I didn't know that. When did that happen?
That happened recently. Wow. So we
permanently?
Well, I don't know if it's going to be permanent, but I know the Fire Rescue is concerned, because if you think geographically, it's along from that northern Miami-Dade, it's a long drive to make it to Miami Children's Hospital, right? To Nicholas Children's. Yeah. So we are able to facilitate in our pediatric emergency room to address the needs of the individuals that live in that section of North Miami-Dade. So these are the type of things that we're doing, our outreach, our engagement, to let the people know when it comes to, again, geography works. We know the consumer is not willing to travel more than 30 minutes unless it's a major thing. Like if you're going to have a heart transplant, you're willing to travel wherever. Yeah. But when we talk about bread and butter, addressing pediatric cares, like for example, ear, nose and throat ENT specialist for a pediatric, because kids usually have that, or a GI specialist, because these are things that kids typically have. We are able to facilitate that level of care.
Wow.
And 10 minutes away.
What about, I know a lot of the hospitals open up urgent cares.
Yes.
Do you have urgent cares in Dade, Broward County?
So we do not have urgent cares in Dade, Broward County. Part of the restriction for the Memorial Healthcare System, remember I tell you, established back in 1950s, was for the South Broward County area. So the hospital has to stay within that area when it comes to care delivery for building facilities. I wouldn't be able to take, so to speak, taxpayers' money from South Broward County and build a hospital in North Miami-Dade, because that's not the district that we're supporting.
So explain that to me, because you said taxpayers' dollars.
Yep.
Are you a public hospital, a private hospital? How does that work?
So we are a public hospital. Actually, the Memorial Healthcare System is the third largest publicly funded healthcare system in the nation. Jackson's number one. I believe there's a place in New Jersey that's number two, and we're number three. What does that mean? When you pay your property taxes, for example, your brother and myself, since we're neighbors, when we pay our property taxes, that money, there's a millage that is assigned that goes to the hospital district. If you ever look at your bill, you'll see Everglades, you'll see water management, and you'll see the hospital. So in South Broward County, so think about the guitar. I use the guitar as geographically Griffin Road down to the border with Miami-Dade, and from the Everglades to the ocean. That is the South Broward district. The homeowners there, when they pay their taxes, that millage goes there. The beauty of the Memorial Healthcare System is this: over the last 10 years in particular, we don't use any money from taxpayers' millage rate or taxes to support the hospital. So on Monday, we collect the millage. It's $8 million from the county. On Tuesday, we write a check back to the county and return the $8 million. We don't use any of that money, but yet we exist to provide care to the underserved and those who are unable to pay for health care in that area. So that's the success story of the Memorial Healthcare System. We have been financially strong that we're able to support our residents of South Broward County without the use of raising taxes. So we don't do that. I'm not going to talk bad about any of the others, but I would recommend that you do your review on how much the others collect a year for millage.
Well,
we only collect 8.
We don't want to upset anybody here.
That's right.
Okay.
I don't want to get you in trouble.
No, don't get me in trouble. That's okay. I get myself in trouble, right? I don't know if I did this or not, but I do want to thank before, because so many things we're discussing. I don't want to forget anything. Michael Miller, Grant Miller, amazing people. Of course, we already said thank you to Tommy, the whole system they've got here. Talk about quality. Okay. This is it's not a newspaper. It's a media company that's just amazing what they do. So thank you, Michael. He interviewed me last time. So all right. So let's talk. I know you're not a doctor per se, but what do you see in advances? You said oncology, right? You have a huge oncology system. Okay. So what do you see in advancements that's really promising to society, I guess?
Advancements in society. So I'll go from an oncologic standpoint, because a lot of things happen in oncology. One of the things that we're looking right now for oncology is really when we talk about precision medicine. So 2 people can have the same diagnoses of cancer, and you give them the same chemotherapy. One person gets the chemo and they're doing great and they respond to it. The other person gets the chemo and doesn't respond to it. So what we're looking now is to go to the genomics. We know that in the genes, as we can tailor the medicine, that there's sometimes genetic mutations, genetic differences that need to be addressed, so that we know that this chemotherapy is going to work for Manny, but this one will not work for Vedner, even though they have the similar diagnoses. That's one of the advancements that we're doing, and that precision medicine care delivery. When it comes to cardiology, the advancements that we're able to do in cardiology right now are amazing with our electrophysiologists. And no different than you hear people now with the smartphone, that your smartphone's like, hey, you need to go and see a doctor. Your pulse is irregular. We're doing those advancements and being able to monitor people's heart activities. And more importantly, we're really targeting on population health. We're transitioning our focus. Instead of provision of care, we're looking for prevention of illness.
I saw that happen with insurance companies. They're really focused on it. They even give you back money if you go to the gym, you get back money. If you do the healthcare assessment, you get money. If you go to, it's great. It's a great incentive. But I see that a lot prevalent. Now, let me ask you about, because you said about the genome.
Yes.
I'm not a doctor. I don't play one on TV. So it's about a genome. Now, I took one of those DNA tests.
Yeah.
Okay. Found out great things about my history. Okay.
So now we're cousins.
Yeah, we're cousins. Actually, we are. It's incredible. My history is it's crazy. It's Mali, I think Spanish is my main one. I got all kinds of countries mixed in there. But one of the things, I didn't do the genome one, but there's a genome one. Do those things work? So you can tell if you're predisposed to a specific.
So those are called liquid biopsies. That's the next frontier. So we really don't know. But what's happening is that we're seeing a trend along that line. For example, one drop of blood, we can diagnose you for this. So what we've known through medicine from my 25 years of being in healthcare is we know that there are signals that are sent out through the blood, right? So it's, so to speak, before an earthquake, you kind of get, sometimes you get that pre-warning that a volcano is going to blow and there's going to be, so in the blood, sometimes there's those tracing. Scientists have been trying to interpret what those signals that are being sent through the blood mean. So they're getting closer. The advancements are coming there. You're going to hear, I anticipate within the next probably 6 months to a year, about a move for that. There are two companies right now, in particular in the oncologic space, who are really focusing on doing liquid biopsies, being able to have you give blood and be able to detect a multitude of potential conditions.
Great, that's wonderful. There's an organization, I'm not going to mention their name because they're not chamber members. Just kidding. But their marketing is focused on preventive. They created a whole system. One of the things I really don't like is going to my doctor's office and getting a 10 o'clock appointment and not being seen till 11:30. Yeah. And it was very. I saw it with my mom. She had asthma for many years, bronchitis, and they would go to the doctor's office, and 2.5 hours later she'd call me. She was still there. But one of the things that I'm seeing is more a push towards you come in, we take care of you. I went yesterday, last week, to the doctor's office, and I was like, wow, what is this place? This is, you saw me in 15 minutes. I was inside the doctors, the assistant, physicians, doctors, whatever,
like
the
the
nurse.
MA or the
She took my blood pressure measurements, this, that. In the same place, I was able to get my blood test same day because I was fasting. That quality of service is really, I think, very, very necessary. And we also went through some experiences with my mother-in-law and her hospital I'm not going to mention, where they just wouldn't give us information. And it was during the C times, last year. So you couldn't go in the hospital, and then you couldn't get the information you need. And it's like, what are they doing to her? You don't know. So I know that's one of the things you guys are focused on, is the service and the family, and connecting to the family, letting them know. So really keep that up. But there's one place, brand new, they're opening up offices all over the U.S., and they do preventive. Cool. And they actually, you go in and you're right into, they take the blood test. They I don't know how they do this, but they give you the results right then and there. Yeah. You talk to a doctor right then, and they give you a monitoring device. And then they focus on what it is. They say if hypertension, and they focus on the treatment of that, or the preventative care of that, in a structured way with great follow-up. Yeah. That's the future of medicine. So
Yeah. So you touch base on two things that I want to touch base quickly. I know we're coming up to time.
He's giving me 3 minutes, I think.
So one of the things in particular for the finding out what's going on with your loved one, in particular now with the disruption that COVID has caused in terms of visitation and engagement and at face-to-face.
And we're getting locked up again, right?
Yeah,
some of the hospitals are locking up again.
We are. Unfortunately, there's another spike that's happening right now. We are really going digital with MyChart. So we're an Epic system. Epic is an electronic medical record. So through MyChart, patient's information is available. I mean, immediately, like you can have a X-ray and you will have that result much quicker than traditionally. So your physician needs to be able to review it. In terms of what you're talking about, the patient experience, that's what we're targeting. That's been the target of the Memorial healthcare system. When you come in, to be able to get you in and be able to allow you to be able to go and get the necessary information. So that is the number one call every day. Get the patient in and be able to facilitate for them to be able to go home. But there's other things coming in healthcare. I would love to talk to you about another
let's
time.
do this again. Let me know when you're ready. We'll do this again. I think the Miller family is going to love to have you back here again.
Thank you.
So let's finish off with one. This is a something that we do every show here, and this is great because with your great success. What message can you give our teens to motivate them to follow your footsteps?
Again, from the beginning.
But I want you to talk to the camera. I want you to talk to the teens. So which camera? I want to talk to the teens right there directly.
So my advice would be very simple. And I say this all the time. Find a mentor. Find someone. If you're interested in a particular field, volunteer time, come out, engage with people. It's that level of engagement, building a relationship, understanding the industry that you're targeting. And again, mentorship, listening. You may not follow all of the advice, but hearing the story from someone else's perspective and their journey helps fortify your understanding, and you can build on that, and that will help you build and build your own success as well. So mentorship and finding and engaging and volunteering time to learn the craft that you want to become the expert in.
You broke a record. You gave me goosebumps 3 times today. Okay, so from orderly to CEO of Memorial Hospital Miramar, Vedner Guerrier.
Yes, sir.
Fantastic. Great to have you here. God bless you. Thank you. Thank you. This was really great.
Pleasure.
Thank you, Tommy, our producer. Thank you, Michael, Grant, the entire Miami's Community Newspapers family. Carmen, our VP.
Thank you.
God bless you. Have an amazing week. Be safe. Thank you.
Absolutely. Thank you. Be well.